Now we'll quickly move to another cause of infertility, and this is you trying to talk about the brain factor. Okay, it's called the brain factor, or you can also call it what? Hypothalamic Pituitary Ovarian Axis. Okay, or you can be specific and say the Anterior Pituitary Ovarian Axis. Okay, so how can this pathway be a major cause of what? Infertility? So if we're talking about the ovarian one, of course we are talking about infertility in women. Okay, so this is a whole connection from the hypothalamus to the anterior pituitary. It comes on to act on the ovaries. So we'll talk about all the important things involved in this pathway and talk about if they are not there, then they can possibly cause an infertility, all of that. So disorders of the hypothalamic pituitary ovarian axis, they can indeed lead to infertility because the hormonal signals there that are very important for ovulation, okay, for reproduction to keep going on very fine, they'll be disrupted. Okay, so let's quickly talk about the types. Okay, well, let's still talk about this. Understanding it is actually a hormonal feedback. Okay, so it involves what? The hypothalamus, which is what releases what? The gonadotropin-releasing hormone. Okay, anterior pituitary will respond to what the hypothalamus is releasing, and it will now release follicle-stimulating hormone and luteinizing hormone. The ovaries, follicle-stimulating hormone, luteinizing hormone. Okay, so disruption at any level will be what will now impair ovulation and normal fertility. Okay, so if there's any issue at any level of this, with what will now be, okay, it will disrupt how the ovaries are releasing eggs, okay, during menstruation and all of that. So types of it, we have the type 1, which is hypothalamic failure. So low gonadotropin-releasing hormone will lead to low follicle-stimulating hormone, will lead to no egg released. Okay, type 2, hypothalamic pituitary dysfunction. So slightly altered follicle-stimulating hormone, luteinizing hormone levels. Okay, in conditions like polycystic ovarian syndrome, where hormonal imbalance disrupts how the egg should be released. The type 3 is ovarian failure. This one, high follicle-stimulating hormone, luteinizing hormone is high in the body. So that's to tell you that follicle-stimulating hormone and luteinizing hormone are being produced normally, but it's the ovaries that are not responding to them. Okay, so how to diagnose it is if there's irregular or absent menstrual cycles, if there's infertility or difficulties conceiving, there's low estrogen levels, if the follicle-stimulating hormone or luteinizing hormone levels are increased, but you know, the ovaries, that's because the ovaries are not responding to it. Then if the woman has polycystic ovaries on ultrasound, then that is a group 2. Okay, so treatment, type 1 is lifestyle changes, stress reduction, positive gonadotropin-releasing hormone therapy. Then group 2 is what? Ovulation induction with medicines like clomiphene. Then group 3 is what? Hormone replacement therapy. Okay, so that's what we got for how this, you know, pathway or connection could actually lead to infertility.